External lamina is this. Internal lamina is the inside of the peen. Is it this as well, I'm assuming?
Well, so here in the picture, first layer, external lamina is the first layer.
I made a video doing
Like that inner layer of the prepuce.
Okay.
Sheath of
The
skin
penile
typically
is going to
covering
be on the
non-erect
prepuce.
piece.
Okay.
Your
External lamina
ostium
typically
is
hairs
going to be
skin.
like that opening.
That
Internal
hole.
lamina is the mucous membrane
Okay.
And then
that
your
reflects
fornix
back
is going to
adjacent
be.
to the
I
gland
was just talking to
penis
her about the concept of
until
like
it forms an
a
acute
fornix
angle,
or like
which
a
is
It's
line.
just that groove in there, right?
It's kind of like a
Dead
end.
space, yeah.
Yeah. So like if I were to try to
I
like
think
place a
that's what they're
catheter, for
talking about.
example, I would want it to go through the urethra. If I like stuck it here, it wouldn't have anywhere to go.
Okay.
So it's kind of just this area around.
Around the sides, fornix. Okay. Paris longoglandus is this thing?
cranial half.
Is that correct?
Yeah. So there's the pars longoglandus and the bulbus.
Bulbous starts where this big old
So I
bulb
think that
happens,
this
right?
is the pars longus.
Yes.
Which is like the cranial portion.
And the
Can you
fornix.
tell you guys where that like turns over nomenclature-wise, like when it becomes the pars
I
longus?
think the bulbous.
Past the bulbous.
I thought past the bulb.
So is it just this?
Is it
Or is
the?
it just this? I don't remember.
So that's considered the paris longus, paralonga glandus. The bulbous is literally this bulb right here, right?
Pretty sure. I'll double check my notes though.
Okay. And the corpus spongiosum, that's the inside, right? I heard you talking about it a little
So
bit.
there's different layers depending on where you are in the penis. Actually, let me pull up my notes and I can show you.
Okay. One more time. So the paralonga glandus is going to be this whole thing after the bulbous, according to our photos, right? That's what we're thinking, right? The bulbus glandus of the penis is this bulb right here, right? The corpus spongiosum glandus, like you just talked about, it goes like, it follows the complete urethra on the inside, right?
Corpus spongiosum penis.
Yes. And then this isn't really a good specimen, but when you would open it, you would see like that layer right there, which is the spongiosum.
I can help you with
Thank
that.
you.
So there's more than just the corpus spongiosum right here. Is
Right.
the thing. So the part, do you see
It's the squiggly stuff, right?
Do you see where that urethra is right there, that
Mhm.
little hole? The erectile tissue around it is going to be your
The
corpus
spongiosum. That like
penis.
squiggly,
Well,
tissue?
The stuff that's closer, because on the outside you have the corpus spongiosum glandus, and I think that this at this point would be the pars longus glandus.
The squiggly looking stuff?
I think so, but that book, here, it's
Testicle saying this way.
Urethral bulb,
So it's
expansion of
facing
corpus
like this is the
spongiosum
bottom part.
penis
Yeah.
surrounded
So
by
the
bulbous
spongiosum should be on
spongiosum
that
muscle.
bottom part.
But like what layer is what we're trying to figure out.
Underneath
So
the.
I'm pretty sure tell tissue there, and I'm pretty sure that
Pars
how
longa
he has that is corpus spongiosum glandus of the pars longa glandus,
Okay.
which is the green right here is what we're looking at.
Okay.
So if you were to take a section right here, where my finger is,
Yeah.
at the bulb,
Oh, that
like
diagram
the bulbus
is-
glandus.
Because it's so close to the tip, so it's hard to tell.
Yeah.
And this is also a confusing picture too. I remember that I was having issues because I was see the urethra right there.
This hole is the urethra? Okay.
So, and the other way that to know that is that we're on the ventral side of the penis.
Okay.
Because on the top side you have the bone, so you
Okay.
can't see the urethra from the top.
Got it.
So on the bottom we have the urethra, the erectile tissue around the urethra, or the corpus
spongiosum.
spongiosum is the corpus the corpus spongiosum
There you
penis.
go.
Then spongiosum glandus of the pars longa glandus on the top.
That annoys me. It's
I
such a
know.
mouthful.
And then if we took a cross section here, which we can look at in a minute, then we would see the corpus spongiosum glandus of the bulbus glandus,
Okay,
because we're
got it.
at the bulbus glandus.
Okay, got it.
And
Here,
the actual bulb, and then it goes like up to like this point, because it doesn't go all the way.
honestly, it doesn't go all the way, and it's something that like you kind of have to feel for, which you're not going to really be able to do on your practical. But like I can feel that it's to here, like that's bone that my fingertips holding, and then it feels like it's bone to there, so that feels like it's the os penis to me right there.
Okay.
Or actually, no, you can
tell
say.
you.
Because like in Spanish and stuff,
can
it means
say.
body, like cuerpo is body.
So this is the dorsal surface of the penis, and this is the ventral surface of the penis.
Okay.
So if we were to just look at this, according to my notes and what we've talked about, if I were to look at this, I can say, yeah, that's the bulbus glandus
Okay.
right there, and that would be the pars longus glandus.
Okay.
I would think. according to everything that I've read. Then right here we've got the portion of the penis that's going to be internal, and I can palpate that the bone is still there, so we probably wouldn't have much, if any, corpus cavernosum penis on here. If we take our cross section, we've got the bone, and then that little circle right there is the urethra.
This one right here? Urethra?
So it's hard to see, but there is some tissue around that urethra. It's very thin. That's your corpus spongiosum penis.
Okay.
Because you know that surrounds the urethra.
Surrounding
all
the
way-
urethra. Okay, got it.
all the way down. Then on either side, because we are past the bulbus glandus, this erectile tissue on the outside here, these erectile bodies,
Right in here?
yeah, where the squiggly stuff is, that, in my opinion, is the corpus spongiosum glandus of the pars longa glandus.
Okay.
Whereas here, where we are in the bulbus glandus, this tissue, which I don't know why they'd cut it like this. They probably have a reason, but whereas here is that corpus spongiosum glandus of the bulbus glandus.
This?
Yes, I think.
And what is on the outside of it?
And then I think this, just according to the drawing right here, would be the corpus spongiosum glandus of the pars longa glandus. So like this tissue is what's here,
Okay.
but this deeper, this deeper in here where the actual bulbus glandus is, that should be the corpus spongiosum glandus of the bulbus glandus.
Right in here. The
Yeah.
squiggly stuff in there.
I'm pretty sure.
Okay.
What is on the top of it, like that?
Like the outside
Yeah.
stuff.
That's a good question. I'm not really.
Okay.
That's retractor penis muscle?
Yeah.
This right here?
Yes.
And where was the tunica albuginea again for the penis?
So,
There?
Inside, yeah, it's the inside.
Tunica
layer.
albuginea.
Yeah.
What is this?
This is parietal vaginal tunic and then visceral vaginal tunic.
Yeah,
So
and then-
what's considered the it's this layer right here.
So you can't
That-
really
right
see
in
outside
there.
them, but
The
like
outside.
the outer part of this outer little capsule is your visceral.
vaginal
Thank
tunic.
you. And then the inner
Like
layer
that
of
inner
the
layer is the
capsule.
tunica?
Yeah.
Oh,
It's
okay.
like the white, like ring almost
Got it.
around it.
So your visceral is it's basically the surface of the testicle. Your parietal is this little sac right here.
Mhm.
That's the parietal vaginal tunic. And then there's the external and internal
Lamina.
lamina. Yeah, the
Spermatic
spermatic
fascia.
fascia, and then the tunica dardos is the outermost layer.
Tunica dardos, like this is the tunica
It's
dardos?
like
So
that
this
here.
is skin. It says it's inside the skin.
Okay.
So just after the bone.
So body of the penis is right here. This would be the glans, because this is like the bulbous area, right? And then the root would be, the crura roots would be up here.
Yeah, it's where it kind of attaches to
The body.
pelvis.
Urethra,
So tiny.
os penis. So right here is your spermatic cord, you said?
This whole thing is your spermatozoid.
That whole thing.
Everything that goes through your inguinal canal.
That whole chunk of meat. Okay.
I can tell you what begins at the deep inguinal ring and ends at the testes, contains testicular artery and vein, ductus deferens, ductus deferens arteries and veins, testicular nerve and lymphatics, and vaginal tunic.
Parietal vaginal tunic, visceral vaginal
This
tunic.
one's pouches.
And then you said the tunica albuginea is this right here.
We can see in the pouch is like above the rectum, because this is colon, or rectum right here. Then we have the female genital tract, this is the bladder. So we're basically going to have pouches between all these structures. And what a pouch is, to my we have the colon, or the rectum. So this pouch in here would be the pararectal pouch, and then between the rectum and the genital tract, we have the rectogenital pouch, which is in here, and the bladder. We have